A few years ago, you were at the BC Prayer Breakfast, and you gave an amazing talk there, your story, and then about how you came out of depression and how you dealt with it. And I'm wondering if you'd share some of your story with our church family. A lot of them wouldn't have heard that, and then some of your thoughts around how you dealt with depression. Any advice that you'd give a local church on this would be really great.
Well, thank you so much for all the work that you do and for really focusing on this very important conversation. It's so important for so many British Columbians and Canadians, certainly people at UBC. I don't think many people are aware that 1 in 4, in some cases, individuals are really struggling with mental health challenges. So there really should be no stigma about talking about challenges that we all face. We talk about our physical ailments with physicians. It's important when we have a mental health challenge to be comfortable speaking about it with our loved ones, with members of the church, and also with healthcare professionals. So thanks for your work in really tackling the stigma associated with being able to talk freely. My own experience was that, as you may know, I had quite a few challenges as an adolescent and as a young adult. I actually attempted to take my life twice, once at the age of 14 and to overdose, and later in life as a young adult in my late 20s. And so that's really the context of what I spoke about at the prayer breakfast. It was somewhat intimidating to speak to such a large number of people, but I was encouraged to be very open about my faith. And to answer your question in terms of how to deal with my own challenges that were significant at the time, it required a combination of things coming together. One was proper medical attention, a number of different sessions with psychiatrists, as well as with a medical regimen in terms of pharmaceutical regimen in terms of dealing with my depression. So it took quite a bit of time, a number of psychotherapy sessions, as well as medication. And also, I would say that the biggest positive aspects for me getting past this, and now I have been essentially symptom-free for decades, almost 2.5 decades. But the success rested upon my family, number one. Number two, Jesus Christ and the church community, and how supportive they were, and how important faith is to grounding myself. And third, I would say that in addition to my family and to church, it was really important for me to focus on work-life balance. So, and then of course the psychiatric and medical attention were key as well. I did struggle. I was a graduate student at McGill University, and I was struggling then. And I would say that was when I met my wife to be. We're still married, and she actually introduced me to her church, Westmount Baptist Church. I was baptized. That was really a pivotal moment in my life when I was baptized. But even before that, when I was in university, I was involved in InterVarsity Christian Fellowship there, and there were Christian students. Prior to that, I was in a family that never went to church. I didn't know anything about the story of Jesus Christ. And so my very first encounter with a church was at university, where Christian friends brought me to InterVarsity Christian Fellowship, to their churches in their hometowns. But really a pivotal moment was as a graduate student. When I was struggling, I met my wife to be, Wendy, and she brought me to Westmount Baptist Church in Montreal, and I got baptized. But even with that, I would say that there was still, after that, in my late 20s, I was going through some significant issues in terms of getting funding for my laboratory. And my wife was in Boston, I was in Baltimore. So it was a very stressful time. So I had a second suicide attempt in my late 20s. And it was at that time, for the first time, that I sought medical attention. And then I started to devote more of my life to going to church and to Christ and to kingdom building, if you will.
I know one thing I really respect that's happening at UBC. You have something there that I was reading about and hearing about, was the Thrive program, where you've really, as a leader, have said, okay, how do we help our students be healthier? Because obviously they're a lot of them are facing these challenges and the stress of university and being there from another country and all those factors. So I guess my thought is, how as we leaders be more proactive in dealing with this and helping our constituents be healthy?
Well, we've essentially doubled the amount of resource that we're putting into mental health supports. We've worked together with the provincial government as well, and we have implemented new programs that are remote, because a lot of our students are actually studying remotely. So a 24/7 call-in line has been established, both with resources from the university as well as from the province. That's something that's relatively new, that we partner with the province of British Columbia. And so, and in addition to that, we have started to build more space for students to actually meet with counselors. We've hired more counselors and psychiatrists. We're in the midst of trying to recruit an institution, a chief student health officer, if you will, a very high-level person that will really look across all of our offerings and all of our supports to make hopefully transformational change in how we support our students. But this pandemic, to your point, has affected everyone. And I'll be speaking in a panel for the Conference Board of Canada about our findings. There have been a number of different newspaper articles that have come out of something that we're supporting, which is an analysis of what's happening on university campuses, both north and south of the border, both in Canada and the US, with respect to increasing need and the need for more resource. And that's been published over the past several months in a number of different newspapers, including the Toronto papers as well as national papers. These articles from the results that we are gathering will be shared broadly with the general public. So to answer your question, we're doing a number of things here at UBC, but there's a huge need across all of the campuses, all the sectors that have been affected by the stresses that accompany COVID-19. I would say one of the things that I think we need to do, and I've spoken to superintendents, I've spoken to education ministers across Canada, I've spoken at the White House in the United States and in summits that are focused on mental health, that we really need to have national plans about how to deal with this very significant process. And people talk about the pandemic, they talk about climate change, but I can tell you something that we're going to have to deal with for years into the future is the impact of the stress associated with the pandemic on all sectors of the economy. And we're going to have to develop national plans and provincial plans. And I think all companies, as well as all universities and colleges, are going to have to really think about how to address the root causes of mental health or depression challenges, and are going to have to commit more resource to meet the need that is surging in not only universities and colleges, but also throughout society.
There was a study that was done in the US. They do a study every year there on national health. And it was an interesting stat that in every area, mental health had decreased except for those who attended church weekly, not monthly. The monthly one was down, but the weekly ones actually had an improvement in mental health. I thought that was an interesting stat that came out of there.
Doesn't surprise me at all. Doesn't surprise me at all. The positive effect of going to church or just listening to a sermon, most of the sermons now are remote, have a very, very positive effect on my well-being.
What would you say to our church world? Because I think the church can do, and I'm speaking to myself here, I think we can do a better job of helping in this area, because we do offer that spiritual component, which is, I think you have to fight it on all fronts. What do you say to the church? How do we prepare for this? What should we be doing?
Well, what you're doing right now, talking about it and removing the stigma is a huge first step. But I would encourage you to provide spaces, safe spaces, for different kinds of people in your congregation to come together to support each other, to perhaps bring in professionals and perhaps can help you with that, so that they can hear from experts about how to deal with the stresses and the mental health challenges that accompany the pandemic, and the fact that many people have lost their jobs. Maybe individuals have lost loved ones to COVID-19. So we're at your disposal. If we can be helpful, in suggesting people to come to speak with your congregation or subsets of your congregation, you're already off to a great start. And there are a lot of resources that are available. We'd love to share, aspects of our Thrive program with you. So we're your partners here in Vancouver, and we'd love to share and help members of your congregation as well. In turn, we really need your help, because as I said, there's the spiritual aspect of healing, and we're a secular university. We're fortunate that there are a number of churches here in Vancouver, and many of our faculty, staff, and students go to your church. So you're helping us, and so let's join forces. And we really appreciate you're focusing on this right now in this conversation, and we'd love to have follow-up conversations about how we might be supportive of you.
Well, thank you for taking time out of your day, Dr. Ono. And hey, we'd like to be in touch and work with you some more on this issue and collaborate as we go forward. I know we're going to be looking more at this in the days to come. I think to your point, there's a lot of work yet to be done as a result of the pandemic. So we'll look to you for more help.
With God's help, we can do anything. God bless you.